Good morning. Today's topic is acute limb ischemia and peripheral arterial disease. I will tell everything about acute limb ischemia and peripheral arterial disease in a very smooth and relaxed way. No stress at all. So please listen this video when you are chilling and relaxing. I will also add some questions, small quiz, so we all be together in this video until end. I will give you a lot of informations in a very smooth way. So you can answer in your exams, you can handle the patient if you are admitting the patient in the hospital, and even if you are working as outpatient physician. I was called last week to admit a patient with acute limb ischemia. Acute limb ischemia is a medical emergency because if you are not going to act in a timely fashion, your patient can lose the limb, and even the mortality rate in the first year is very high, it's 15 to 20%. So I knew that I have to act in a timely fashion. When I was going to the patient room, I already knew in my mind what questions I'm going to ask, what I'm going to see, what test I will order, and what treatment option I will offer to my patient. So whenever you hear acute limb ischemia, 6 P's should come in your mind. P is pain, paresthesia, pallor, pulseless, poikilothermia, and paralysis. We have 3 diagnostic options. Number 1, arterial ultrasound or MRA or CTA. If your patient has contraindication to any test, you can order the other tests. We are pretty good in diagnostic testing. And the treatment option is anticoagulation and fractional heparin infusion. So in few minutes before I entered the patient room, I know what I'm going to do. My patient was telling me that he is having severe leg pain. In the right leg, he was having pain, he was feeling cold, and he was having numbness. I checked the pulse, I didn't find the dorsalis pedis pulse. I used the Doppler, I didn't find it. I know this is acute limb ischemia case. My ED colleague already ordered stat ultrasound, and I knew that the result will be there in any moment. I spoke with my patient about treatment option. He had no contraindication to heparin, so I ordered heparin infusion. I also called the vascular surgery for safe side. They agreed with the plan, and they told me they are going to see the patient in few hours and will proceed with endovascular surgery if needed. So now you can see that in few minutes, you can handle acute emergency case in a relaxed way and efficient way. Anyway, my patient was having heparin drip. I rechecked the patient because sometimes when you start the infusion, the patient can develop pre-occlusion, the patient can have edema, or the patient can develop the compartment syndrome. My patient did not have any of these, fortunately. Acute limb ischemia is the severe form of PAD. Now we will talk about PAD. PAD is equivalent to CAD, coronary artery disease, same risk factors. Tobacco dependence, hyperlipidemia, hypertension, and diabetes. Okay, so let's talk about PAD. What are the symptoms of PAD? So your patient can come with the exertional extremity pain. It could be any extremity, upper limbs, lower limbs, arms, legs, anything. Second one is intermittent claudication. And number 3 is non-healing ulcers if your patient has. Okay, let's go with a quiz. If you're seeing a patient suspecting PAD and your patient is complaining of intermittent claudication, how you can diagnose if this is intermittent claudication related to PAD or this is pseudo-claudication, which is due to spinal stenosis? I know you have so many answers in your mind. You are right. I always do 2 things. First of all, I ask if my patient's pain resolves and in how many minutes. If my patient says my pain resolves within 5 minutes, I know this is true intermittent claudication secondary to PAD. If my patient say, oh no, my pain resolves in less than 30 minutes, might be, more than 5 minutes and less than 30 minutes. This is pseudoclaudication because of spinal stenosis. Then I always ask my patient to bend forward, flexion, and tell me if the pain resolved. If my patient tells yes, it means that this pain is because of spinal stenosis related pseudoclaudication. Okay, now your patient comes having symptoms of PAD. What first test you order? You are absolutely right. You order ABI, ankle brachial index. Normal range is 0.90 to 1.40. If your patient's ABI comes back less than 0.90, means your patient has PAD. Second question, if ABI comes back 1.40 or above 1.40, what do you do? Absolutely right, because your patient has non-compressible calcific vessels. That's why ABI test is not going to diagnose the PAD. So what test you order? Of course, you will order toe brachial index test. Absolutely right. Third question, if your patient test result comes back within the normal range, 0.90 to 1.40, and still you are suspecting your patient has PAD, what test you order then? Right, you order exercise ABI test, because exercise ABI test will tell you if your patient has PAD. Wonderful. Now you diagnosed your patient with a PAD. Then how you are going to proceed? Of course, smoking cessation education. If your patient is smoking, you will treat hyperlipidemia with a statin, you will treat diabetes, and you will treat hypertension. American Heart Association and American College of Cardiology recommendation for blood pressure goal in PAD is less than 130/80. Okay. What medications are you going to start? Aspirin, because it is equivalent, PAD is equivalent to CAD, of course. If your patient is allergic to aspirin, then you can give Plavix. Currently, no guidelines are available for dual antiplatelets therapy. So aspirin, and if your patient is allergic to aspirin, give to Plavix. Next question. If your patient needs symptomatic management, what you do? Yes, you can enroll your patient in the exercise program, and really it works very good. And second thing is you can prescribe cilostazol, but cilostazol needs to be addressed if your patient have congestive heart failure, because you cannot prescribe cilostazol if your patient have congestive heart failure. Wonderful. If your patient is still complaining of PAD symptoms with all the management we discussed, what else you can do? You can proceed with diagnostic testing, which we discussed in acute limb ischemia, arterial ultrasound or CTA or MRA, because now you are going to find out the level of occlusion, and you can send patient to vascular surgery. Might be patient needs endovascular procedure. Okay, so this was all about emergency acute limb ischemia and peripheral arterial disease. I hope you like this video. If you want to subscribe, do it, so when I will make next video, you can get notification, and then we will go through learning procedure together. Thank you so much.